This video is going to talk about facial rejuvenation and all the different methods I have to perform facial rejuvenation. Now, obviously, this video could last 14 hours, so I'm not going to be able to cover everything in detail. What this is going to be is intended to give you an overview of understanding how I approach the face. The number one thing I try to do is create a better blink. And better blink essentially means that when someone looks at you, they have a feeling that your face looks younger, more attractive, and it has a lot to do with facial shaping, things like that. And that's really going to be more articulated in a video on facial fillers. But what I want to talk about is that some patients come in and they say, look, I don't want to have surgery. Only thing I want is non-surgery. And I have some patients that come in and say, I only want surgery, I don't want to have frou-frou things in the office that don't last. And so what I try to do is talk to you about the merits of both, because there are some things that surgery will not accomplish, and I need to be in the office to treat that in the best way that I can. And there are certain things, if you're not ready to do surgery, that's fine, but if you have enough advanced problems, I will not fix without surgery. So the goal of this video is to talk about how I use both of these complements to achieve excellent outcomes. So number one is I'm an artist that applies really both techniques, surgical and non-surgical, in the right patient. So some patients really just need non-surgical. But the patients that need surgery oftentimes would benefit from some non-surgery. So let's talk about this. So for patients coming in to me in their early 30s, unless they have a big eye bag that they're born with or they became more prominent, from a facial rejuvenation standpoint, most of them probably could do very well with just fillers. Fillers, Botox, small office-based procedures that do well. When you start to get older, when there is a lot more sagging of the jawline, I have tricks. You can look at some of the videos on Botox for neck sagging. It's great for early neck sagging and some Sculptra for neck wrinkles, but ultimately there's nothing comparable to a neck lift. The recoveries are relatively short with that. You can watch some videos where I talk about that, but in this video I'm just trying to give you an overview and a flavor for the limitations for each one and how they serve as a complement. So eyelid surgery, if there is really enough volume loss around the eyes, the person would be justified to have fillers or fat around the eyes. But if there's skin that's hanging over what's called the ciliary margin or very near the eyelid margin, then that person would really benefit from having an upper eyelid procedure. So let's break down the non-surgical first, and then we'll talk a little bit more about the surgical. And again, this is an overview video, so it's not going to go into too much depth. So from a perspective of non-surgical, let's talk about, there's really two big categories. There's Botox or neuromodulators, the same thing, and facial fillers. So Botox, again, I encourage you to watch the videos I have on Botox, and I got quite a few of them, but the nuts and bolts of this is that when people have wrinkles in the upper face, it's a dynamic problem that gets progressively worse. And if you don't treat that with Botox, there's really no brow lift, facelift, eyelid surgery, fillers, fat, laser that will manage it. And the reason for that, simply put, is that let's use laser as an example. If I laser all your wrinkles away, but you're constantly moving and creating damage, you're constantly making the face worse. So to me, Botox is a cornerstone to what I do. And if someone says, I don't want to do Botox, I just don't believe in it, again, I encourage you to watch my Botox virtual consultations, about 12 minutes long, that really, hopefully by the time you're finished with it, will give you a better insight on why I think Botox is so critical. But Botox is a great example of a non-surgical modality or treatment that really has no surgical substitute. I can't cut away the muscles, I cannot laser it away, I cannot fill it away, I cannot lift it away. It really needs that as an instrumental component toward treatment. And as I mentioned in my Botox video, the more treatments of Botox you have, the fewer that you need in the long run. So Botox to me is a cornerstone toward treatment. The second thing is fillers. So we all lose volume. I don't care if you're 28 or if you are 90, you've lost volume. Now, of course, people that are overweight look like they don't need volume, but if you think about it, especially if you're over 45, 50 and you're heavy, this is full. but the upper face is empty and there's hollowness around the eyes. I'm 48 and you can see my hollowness around my eyes when I take my glasses off, and that volume loss is simply because I'm getting older. And so volume loss is a component to aging. It's a component that transcends, all those decades. So it's something, to me, is the easiest cornerstone of what I do. Again, I encourage you to watch videos on facial fillers and my lectures on this subject to really get into depth. Again, I can talk for hours on the subject. But the few basic principles is the way that we judge a face is the volume loss is around the eyes. So I call it the halo fill, which is around the eyes, around the perimeter of the face, and around the mouth. Where you get into problems are lips and cheeks. This is where people look like that big cheek, looks like a big mound of insanity, because it's a dynamic problem. And I've committed that error in the past. This is an evolution of aesthetics, so that facial volume really should be sitting in a zone that doesn't hit dynamic problems. Lips and cheeks are problematic zones. The lips are not if they're done well, and if the lips are used to blend into the face. But the volume around the perimeter of the face is a highly important area. So as a general principle, the goal is that if the face is heavy down here and I can give volume back up here, the face will actually look thinner. You won't look fuller. And another trick that I use oftentimes, which is non-surgical, and there's really no substitute for this, is I oftentimes Botox down here. And what that does, besides helping TMJ and grinding, is it takes a wide, heavy face and narrow it. So if I've got very gaunt faces, I will slightly expand it so they have a more of an oval shape. And if I've got a face that's very, very heavy and wide out here, I will narrow it with Botox, and that has a really good durability. I was featured in the New York Times for this. I have patients fly in just for this one treatment, but it really gives a good balance. And the other reason is that the net effect is that a face that's heavy down here, if I can invert it and flip it up to here, then the face looks so much more youthful. So that is a very powerful, powerful treatment that makes people look better. Let's go on to the surgical topic, just briefly overviewed here. So a necklift is a procedure that really is also known as a facelift, a lower facelift, and I do it's called a modified deep plane. So I release some of these ligaments that are holding things down. My incisions are very well hidden. Even if you wear hair up, you're not going to see it. Small incision here really creates a good durable result that looks natural. You don't look pulled. But when that neck is down to here, and I'm not talking about extra fat, but I'm talking about like the banding you see, what's called a turkey gobbler, the platysmal bands. When that's sagging, I really don't have any other good tricks. And Botox is a very small temporizing effect, but I've got to have the neck lift to help bring that back up to a better position. And once that's elevated, even though you'll continue to age a little bit, that scar tissue and everything that's holding it is really permanent. And that's about a week to 10 days of downtime. I've been using drains over the last year that really have cut down my swelling a lot and bruising a lot, but I can't promise you there's no bruising and swelling. But that is something that is very natural. There's no wraps anymore. It really is a very powerful treatment to help with the lower face. Another procedure that I do for the upper eyelids is just an upper blepharoplasty, taking a little bit of skin away. That actually can be done in the office. So some patients that need that little extra skin, I just do a little numbing cream, and it's a very easy procedure. Now, when I do that upper blepharoplasty, I want you to understand one principle. This is very confusing because a lot of people think, oh, I just need to have, all the skin removed. And I think people look cadaveric or empty. What I do instead is I fill that area with volume. And then if they have a little extra skin that's on the bottom, that extra 20% that's hanging, that is the person that needs a little skin removal. So I will be honest with you, I only take upper eyelid skin in probably about 20% of my patients. Most people absolutely do not need to have the skin removed, and a little bit of volume, whether it's fat or fillers, will do extremely well to get that result accomplished. And so for the lower eyelids now, I want to talk about treatment strategies for that. The biggest thing for me is I don't believe in cutting the skin, because when you cut the skin and pull this area, I think people's eyelids look different. When the canthus, which is the joining of the upper and lower eyelids, changes, then the person doesn't look like the same person. That's very problematic to me. So the way I do it is a no incision approach, transconjunctival, taking a little fat out. But what's really interesting is that I don't do a lot of those because I don't think people really need it. But if I do it, it takes me about 10 minutes. There's not a lot of downtime, very quick, no change in the eyelids, very little swelling, very little bruising. But the biggest thing I want you to understand with the lower eyelids is that the lower eyelid has a lot to do with volume loss. So when the volume loss of the lower eyelid is significant, most times you just need the volume to restore it. You don't need necessarily the bag removed. So if the bag is big enough that the bag is sitting over the orbital rim, then I really encourage those patients to have the eye bag removed. But even when the eye bag is removed, you still need a little volume. So when someone takes the eye bag out and their weight is relatively stable, then I would do a fat graft and take the bag out, and they get the best results that are out there. If they're just having a little bag, a little bit of hollowness, then a filler usually does very well. And repeated fillers over the long run holds very, very well. But now that's going to introduce my another topic, which is just fat grafting. Now that's a whole different subject. Again, it gets into depth, but this is one of those ones that crosses over from the non-surgical to the surgical, because fat grafting does extremely well from a surgical perspective to replace volume. Some of the pros and cons is if you gain weight, that's a problem, so I typically don't like to do it in younger patients. And also, if you don't have enough volume loss to justify a surgical procedure, then fat grafting may not be the best option for you. But again, I'm going to encourage you just to come in and let me talk to you in person and give you a better gauge of the pros and cons. This video is not to bear down for 10 minutes on just fat grafting, but just to have you understand that volume loss is a cornerstone of what I do, but it can be done through fillers or fat or a combination, and that's just something to talk about. Briefly, I want to talk about a few other, just very cursory, fast fashion of things that would help you. One is rhinoplasty. So we think nose jobs or rhinoplasties are great for the young patient, but oftentimes it's fantastic for the aging face, because when the nose has a hook, it's hanging a little bit, it actually makes the whole face look old. So if I do a aging rhinoplasty procedure, it can really complement a facelift. And about 20% of my facelifts, I do some kind of rhinoplasty, and they don't look different, they just look younger. And so also, in addition, a chin implant, when there's a receded chin and you don't have a good structure to a facelift, a chin implant, which is very easy, can be a good addendum or adjunct toward a facelift. The final component I want to talk about before we finish, well, we're almost done here, is a hair transplant of the upper area of the face. This area can really frame the face, just like a chin implant or facelift can frame the lower face, and eyelid surgery or fat grafting or fillers around the eye can frame the eyes. So hair restoration for women, coming down like this to frame it, because 30% of women over 30 lose hair, and that can be a very powerful treatment for them, but also for men, obviously, that's an obvious thing. Final component is just skin rejuvenation. I'm not going to really go into all the different methods I have for lasers and chemical peels and skincare products, but that is, I always say, it's like when you look at a bed and the sheets are all coffee stained, no matter how good the bed is tucked in, it doesn't look that good. So the skin rejuvenation is a final component. So I know that's a very broad, sweeping discussion of topics, but it just shows you that I have as much surgical treatments as non-surgical treatments, and sometimes good surgery will do it, and sometimes non-surgical will do it, and sometimes a combination will give you the best results. And only in consultation with me will you get a better understanding of how I would tailor that strategy for you.